Alright guys, let's talk about TRT versus steroids. A lot of people think TRT is just healthy testosterone replacement, while steroids are hardcore, dangerous, and only for bodybuilders. But the reality, the line between the two is a lot blurrier than you might think. Doctors are prescribing higher and higher TRT doses. Some guys are abusing medical testosterone, and the difference between hormone optimization and performance enhancement is getting harder to define. So today, I'm breaking down the real difference between TRT and steroids, how they work, the risks, the benefits, and at what point TRT basically becomes a steroid cycle. I'm Dr. Seth Capehart. I'm an emergency physician, a former special operations guy, and I've spent the last 20 years studying human performance and health optimization. I'm not here to sell you anything, just here to help you out. Before we get into it, quick disclaimer, I am a physician, but I am not your physician. This is not medical advice. Before starting TRT or any other hormone replacement therapy, talk to your doctor. All right, what TRT actually is and how it compares to anabolic steroids. So what is TRT? TRT, or testosterone replacement therapy, is a medical treatment designed to restore testosterone levels in men with clinically low testosterone. Testosterone naturally declines with age, and some men experience symptoms like low energy and fatigue, loss of muscle mass and strength, brain fog, depression, lack of motivation, low libido, erectile dysfunction, etc. For these men, TRT can be life-changing. Here's how it works. A doctor prescribes synthetic hormone replacement in the form of testosterone, usually in the form of injections, gels, or patches, to bring your levels back to what is considered normal. The typical TRT dose is 100 to 200 milligrams of testosterone cypionate or enanthate per week, which is meant to replace what the body would produce naturally. But here's the problem. Not everyone sticks to that dose. So what are anabolic steroids? Anabolic steroids are any synthetic version of testosterone that's taken to increase muscle mass, strength, and performance beyond natural levels. That means the only real difference between TRT and steroids is the dose. TRT is designed to restore testosterone to a normal range, usually around 600 to 1,000 nanograms per deciliter, but a typical steroid cycle, that's 500 milligrams to 1,000 milligrams of testosterone per week, plus additional compounds like tren, deca, or dianabol. At those doses, you're not just replacing testosterone, you're elevating it to superhuman levels, which is why bodybuilders look like superhumans. So where's the line between TRT and steroids? And this is where it gets a little tricky. At what point does TRT stop being therapy and start being a steroid cycle? Well, some guys abuse TRT by taking higher doses than medically necessary. For example, running 250 to 300 milligrams per week instead of 100 to 150 milligrams per week. And here's the thing, many TRT clinics won't stop you, and in fact may encourage you. A lot of these clinics are business first, medical providers second. So if you want 250 milligrams a week, they'll write the script. If you want Anavar or HGH, some will find a way to get it to you. And then there's the TRT cruise. Some guys use TRT as an excuse to stay on steroids year-round. They blast high doses of gear, then cruise on high-dose TRT protocol that really just is a low-dose testosterone cycle. So if you're getting your test levels checked and you're sitting above 1,500 nanograms per deciliter or over 2,000 nanograms per deciliter, you're not on TRT anymore. You are on anabolic steroids. The risk of high-dose TRT, also known as mild steroid use, once you cross that line into supraphysiologic doses, you increase your risk of side effects dramatically. Higher estrogen levels leading to water retention, mood swings, gynecomastia, man boobs, increased red blood cell count, thickening your blood, raising your risk of blood clots, acne, oily skin, accelerated hair loss if you're prone to male pattern baldness. Higher doses of TRT will speed it up. Testicular shrinkage and infertility, especially without HCG, your body's natural production shuts down. Potential heart and kidney damage, long-term elevated testosterone levels, increased cardiovascular risk, etc. If your TRT dose is too high for too long, you're basically on steroids just without admitting it. So how do you stay on the right side of TRT? If you actually need TRT, here's how you make sure you're doing it right. Number one, get proper blood work done. Before even thinking about TRT, you need to check your baseline levels, total testosterone, free testosterone, sex hormone binding globulin, estradiol, and hematocrit. Number two, start low and go slow. I would suggest 50 milligrams per week is plenty to start, and then go up slowly over a period of a couple of months. There's no need to jump to 200 milligrams immediately. It's likely too high of a dose for you and will throw you into the anabolic steroid range. Number three, monitor side effects and adjust accordingly. If estrogen goes too high, consider adjusting your dose of your testosterone before using an aromatase inhibitor. If you're getting high hematocrit levels, donate blood or lower your dose. Number 4, avoid underground TRT clinics. If your provider is pushing Anavar, HGH, or performance stacks, you're not in a real TRT clinic, you're in a legal steroid shop. So, final thoughts. TRT versus steroids, which one is right for you? If you have clinically low testosterone, TRT can be a game changer for your health and well-being. But if you're pushing the dose higher than necessary, stacking extra compounds, or using TRT as an excuse to stay on steroids year-round, then you're not on TRT anymore. You're on gear. Just admit it. So, the real question isn't just TRT for steroids, it's are you optimizing your health or just chasing gains? Be honest with yourself. If you're not ready to commit to TRT for life, I highly recommend watching this video next on the best supplements to boost testosterone naturally. If you're already on TRT, drop a comment below, let everyone know what your experience is like, and help other guys who are interested in possibly going on it. If you found this helpful, please help out the channel, hit like, subscribe, comment, all of that stuff. Your testosterone is your power. It's time to reclaim yours. See you next time.